everybody. Welcome back to Bayou Time. Harry McCulla here. October is Breast Cancer Awareness Month, and for that we bring in Dr. Sukath Manthri. Thanks so much for being here. Of course, you're a resident oncologist with the Terrebonne General Health Systems and the Mary Bird Perkins Cancer Center. So you're new to our area, and there's been a lot going on. Tell us a little bit about yourself and how are you enjoying your stay besides Hurricane Ida and a pandemic that you've been dealing with since we've been here.
Thank you for having me here today. As you mentioned, I'm one of the newer medical oncologists at Terrebonne General Mary Bird Perkins Cancer Center. Okay. I did my graduate education back in India, and after graduate education, I moved to United States. I did my internal medicine residency at Southern Illinois University in Springfield, Illinois. Later moved to St. Louis to finish my hospice and palliative care fellowship. Then completed medical oncology fellowship at East Tennessee State University. Then moved to Louisiana. Have been here for 15 months, like you mentioned. It's been eventful. I think storms and Hurricane Ida, but I think so far I think people have been nice here.
Yeah, welcome. Do you have hurricanes in India, Doc?
Where I'm which part of India?
Yeah.
I think usually we don't. Okay, we have a stable weather.
Yeah, so we'd like to break you in real good here, Doc, for sure. Hey, let's talk about what we're here for. Let's talk about breast cancer. What exactly is it? What are we looking for and forms of it? And when you have a month where it's awareness, what are you guys doing there?
Okay, so breast cancer is the most common kind of cancer among women, and it's the second leading cause of death among women after lung cancer. Okay, so a little bit about breast cancer. So breast has got lobules as well as ducts. Okay, these are lined by cells. Okay, when they are lined by cells, when these cells go bad, they multiply rapidly, and cancers of these lobules, which are also called milk glands, or the ducts, which are called milk carrying ducts, are the most common kind of breast cancer. Okay, and mostly diagnosed in women, but rarely can be seen in men also.
Right, and it's important to always be aware of that and to be looking out and mammograms after age, what now, 40?
Yes.
Well, I guess depending on the family history, right?
Yes. So majority of the women, we risk stratify women. They either fall in average risk, which are majority of the women, where their lifetime risk of developing breast cancer is close to 12.4%. Okay, or they might fall under moderate or high risk. When the risk is 15 to 20%, they fall as moderate risk. When it's more than 20%, it falls as high risk. Okay, so average risk women, we tend to do a screening starting at age 40. 1 to 2 years.
I see. And we were looking at that at 1 in 8 women might have a shot at getting breast cancer. So it's very, very common and something you need to catch early.
Yep. Okay. So breast cancer, like I mentioned, is the most common cancer among women. Okay. So 1 in 8 women, which turns out to be approximately 12.5% lifetime risk of developing breast cancer, because the incidence is high. So if you catch early, you can cure these patients without significant morbidity.
Right. So what are like symptoms? Is there symptoms? I know that there was a gene at one time. I know they talked about the BRCA gene. My wife has a family history of that. I know that's something we look at. But are there symptoms that people should be looking out for?
So breast cancer symptoms usually are not specific to the cancer itself, but they can be present in other conditions too. But few symptoms should immediately prompt medical attention. One is if you feel a lump, which is different compared to your usual breast tissue. That's number one. Number two, sometimes if there's some nipple discharge or nipple inversion, or if there's any rash around the nipple, okay, sometimes distortion. These are some things which we need to keep in mind. We need to promptly seek medical attention.
Doc, off topic a little bit, we've just had a big storm here. We've talked about the mandates today. The mask mandates are just kind of loosened up a little bit. Over the COVID world, we've talked about people coming to get treatment. Do you find now the hospital took some damage? What about people coming in and now trying to get help and trying to get back on a routine like that?
Yeah, pandemic as such has scared certain people. They did not want to be exposed to the healthcare, so they actually deferred some of the medical treatments if they're preventatives like screening stuff or with the curative intent treatments or anything. They deferred it because they did not want to get sick with the COVID-19. Along with that, recent Hurricane Ida, I think put a pause on our healthcare resources also, but we're glad at Terrebonne General. I think we were able to bring majority of our services back online, and I think most patients are able to get those services which they need at this moment.
Yeah, we were talking, I thought it was just electable, things that are electable, but yeah, a lot of folks were just scared to come in. So that's very important, and I guess that's why you guys are open and ready to do screenings and those kind of things now.
Yep. So I think all the imaging services are open right now, and we are able to do screening imaging studies that's needed for the patient. All the outpatient clinics are open. Any needs for the patients will be addressed in the outpatient care setting also. And starting of this week, we started inpatient services also at Terrebonne General for patients like if they needed cancer-directed surgeries. Okay, after surgery they might need to be in the hospital. So we are able to use the operating room and able to admit those patients if they need any post-operative care at this moment.
We've talked a little bit about it is breast cancer awareness, and that's some of the which y'all this month, but that's a big part of what you're doing. Tell me about some of the risk factors that we're looking for as far as breast cancer.
So risk factors for breast cancer usually are modifiable and non-modifiable. The list for a non-modifiable are few. Okay, one, female sex. Okay, so it's 100 times more common in females compared to men. Okay, usually cancer is a disease of aging, and the most common kind of breast cancer is hormonal driven breast cancer. So as we get older, there's an increased risk of breast cancer. Okay. Along with these two, family history or personal history of breast cancer increases risk of breast cancer. Patients who already have a personal history of breast cancer, they can develop breast cancer in other breasts. Okay, and rarely 5 to 10% of patients can have a hereditary breast cancer, meaning running in families, like the most common one being BRCA. Angelina Jolie had a BRCA1. But it's only seen in 5 to 10% of patients. Majority of breast cancer is sporadic. Okay, few other risk factors, non-modifiable risk factors are early menarche, late menopause, or a history of radiation exposure for other cancers. Okay, so let's move on to the modifiable risk factors, which is very important. I think among the modifiable risk factors, two things which stand out are maybe quitting smoking and decreasing alcohol intake is very important. Okay, quitting smoking can help prevent a lot of different cancers, head and neck cancer, lung cancer, and so on. And the second important modifiable risk factor would be regular physical activity and losing weight. Maintaining healthy weight is very important. That decreases risk of developing breast cancer.
Very, very interesting. I'd always heard that it was more hereditary, but you're saying it's only 5 to 10%, which is really interesting. And losing weight, staying in shape, exercise, great ways to do it. Mammogram is obviously a way, and we talked about it briefly earlier. At 40 years old, is when a lot of times they start doing mammograms. Who qualifies for mammograms, and what does that entail? Some people are not always comfortable with that.
Yeah, mammogram is similar to an X-ray, where it's a simple arc. The X-ray arm actually allows the qualified technician to look at this X-ray, and it can look for any suspicious area as well in the breast tissue itself. There are several different organizations here in United States which give us guidelines regarding how often to screen for breast cancer and when to start screening for breast cancer. And European guidelines are different compared to United States guidelines. In general, consensus is to start screening for average risk women at age of 40, okay, after discussing pros and cons. It can be either done once a year or every other year. But ages 50 to 74 all women need to consider doing annual mammograms. It's 75 and above. If their health status is good and if they have a reasonable life expectancy, they should continue doing screening mammograms for these patients.
I see. I see. Well, the Cancer Center now offers, the latest, and I guess are there different types of mammograms? Or if there's a latest form, obviously what you're doing. Can you shed some light on that and what are the different types?
Historically, we've been doing 2D mammograms, okay, but I think majority of the centers are moving to more advanced technology. I think TGMC is proud to provide this new advanced technology. It's 3D mammogram with tomosynthesis. It's similar to 2D mammogram, but we add a tomosynthesis to it. This advanced technology allows us to identify cancer at an early stage, and it gives us more accurate information, and it helps us to diagnose and treat cancers at an early stage.
Right. So, look, fortunately, we have a great cancer center here, right here in our backyard. What services, it's not all obviously breast cancer, so what other services do you guys provide?
So, Cancer Center has got both medical oncology as well as radiation oncology. We have currently we have 4 providers in medical oncology and 2 providers in radiation oncology. We treat all kinds of cancers, and we also treat some benign blood problems as well as cancerous blood cancers also at this moment. And Cancer Center is blessed with a multidisciplinary team approach to treat our patients. So we have support staff like a social worker if needed. We have a dietitian for patients if they need during this cancer journey while they're on treatments. And we have other kind of supportive services that might be needed.
I see. Yeah, 10 providers there, and that's great. So you offer surgery, radiation, chemotherapy, hormonal therapies, targeted therapies. Now, you also have Live Well by You that's coming up. Can you talk to me a little bit about that?
So Cancer Center, I think Terrebonne General is doing this free cancer screening. It's by name Live Well by You on November 6th. Okay. We can call and schedule appointment by calling 985-239-5739. On this day, I think you can be screened for breast cancer, colorectal cancer, skin cancer, along with prostate cancer.
Which are all, and does our area have anything to do with it? I mean, you're seeing this everywhere, right? Those kind of things. And, sometimes we've talked about where we live and all, but from what I understand, actually, that area is not that big a factor. It's more the risk factors you talked about being, exercise, health, and those kind of things. So, Docs, thanks so much for joining us. We appreciate it, and best of luck, and appreciate you being here. We'll be back with more Bayou Time right after this.